talk about the normal epigenetic histone H1 fucosylation and how you regulate macrophage plasticity in rheumatoid arthritis. So the first part of my talk is the fucosylation. It's a hallmark of inflammatory macrophage, and it's also a therapeutic target for RA. So what's fucosylation? Fucosylation is the addition of fucose residue to the either O-glycan or N-glycan, or directly linked to the serine or bearing of the peptide. So fucosylation is one of the most important glycosylation process, and auto fucosylation is involved in regulation of cancer cell death. However, the role of fucosylation in RA had not been studied. So we look at the expression of different fucosyltransferases, including FUT1 to FUT13 in synovial tissue from RA and OA patients. And it seems that almost all the expression of almost all the FUTs are highly upregulated in RA synovial tissue compared to OA, especially FUT1, 2, 3, 4, 5, 6, 7, 9, 10, 12, but not 8, 11, and 13. That might suggest that different subsets of fucosyltransferases might play a different role in the pathogenesis of RA. This is the differentiation model of M1 and M2 macrophage. M1 is also defined as inflammatory, M2 is anti-inflammatory. So there's imbalance of M1, M2 macrophage in RA, as I mentioned earlier. And we are trying to figure out whether FUT1 is also upregulated M1 macrophage. We isolated different cell population from synovial fluid from RA patients, including CD4 positive monocytes, total CD4, naive CD4, memory CD4, Th1, Th17, M1, M2 macrophage, and fibroblasts, and measure the expression of different fucosyltransferases by real-time PCR. And very interesting, the terminal FUTs are highly expressed in M1 macrophage, but not in M2 macrophage or T cell or monocyte or fibroblasts. And on the other hand, the core fucosyltransferases are highly expressed for T cell and fibroblasts. And it's very interesting that all the terminal fucosyltransferases are highly correlated with TNFα level in the joint tissue. However, the core fucosyltransferase didn't exhibit the correlation at all. So this is the quick summary of the study. Expression of the most FUT, especially terminal and subterminal fucosyltransferase, is highly correlated with TNFα. However, the core fucosylation and O-fucosylation doesn't correlate with TNFα. And those fucosyltransferases that are correlated with TNFα are restricted in M1, inflammatory macrophage, from the human eye synovial fluid. So to further figure out what's going on, how fucosylation regulates the inflammation process, we are trying to use a fucosylation inhibitor, which is called 2-deoxydegalactosis. We call it 2-degal. It has a very similar structure to the nature degalactosis. The only difference is on the two position of the sugar ring. The inhibitor doesn't have a OH residue here. Therefore, it doesn't have capability to link the fucos linkage here, alpha 1, 2. That's how it inhibits the fucosylation formation. By using the fucosylation inhibitor, the CIA development almost completely blocked by this inhibitor. And on the other hand, the fucos facilitate the process of inflammation, as shown here in the image of the joint, and also the histology. Fucosylation inhibitor also suppress the production of anti-C2 antibody in the serum, and also TNFα IL-6 production in the circulation. We then further look at the cell phenotype in the general lymph node of the CIA model. As the flow cytometry data show here, 2D-GAL reduce the percentage total cell number of CD1B positive, TNFα positive, or CD1 positive, IL-23 positive, M1 inflammatory macrophage. And fucos, on the other hand, increase the percentage of the number of these inflammatory cells. And fucosylation inhibitor also reduce percentage of Th17. Then we try to figure out the molecular mechanism, how fucosylation inhibitor change the polarization or development of macrophage. We use the cell, that's the bone marrow-derived macrophage from DVM mice. We polarize the bone marrow cell towards M1 direction by using GM-CSF, and co-culture the cell with 2D-GAL from day 0 to day 7. And here we look at the cell. And very interesting that high doses 2D-GAL completely block the differentiation and kill the cell. And we observe the same phenotype by using the human synovial fluid macrophage. However, it didn't have any effect. The fucosylation inhibitor doesn't have any effect on synovial fibroblasts, as the images show here. The morphology and the biology of fibroblasts, they are almost identical between these three different groups. Therefore, this data suggests 2D-GAL fucosylation inhibitor act on the macrophage specifically without targeting other cells in the joint. And we also perform different osmolarity control, including glucose, sodium chloride, and glycerol. And this data suggests that the fucosylation inhibitor effect is 2D-GAL specific. It's not due to the toxicity of the chemical. By using a lower drug and lower concentration of fucos inhibitor, the cell that was polarized towards M1 direction can be reversed towards M2 direction by increasing the IL-10 production or inhibit the interferon gamma production. That suggests that 2D-GAL really can skew the M1 towards the M2 direction during the macrophage development or differentiation. The summary of the first part, fucosylation is a hallmark of inflammatory macrophage. Fucosylation inhibitor can prevent the M1 macrophage differentiation and skew it to a M2 macrophage. And the inhibitor also block the development of arthritis, the CIA, by using the CIA model. And fucosylation inhibitor suppress the Th17 and M1 macrophage development in the general lymph node. So the next question we are trying to answer is, how does fucosylation regulate macrophage differentiation and polarization? This is the second part of my talk. It's about the epigenetic mark, histone H1 fucosylation, and how it regulates macrophage differentiation. After we finish the CIA model study, we're trying to figure out how fucosylation inhibitor can change the macrophage differentiation. And the first thing we are trying to figure out was which protein is really fucosylated in macrophage. So we perform a lectin pull-down coupled with mass spec analysis. And it turns out the protein that's highly fucosylated in M1 macrophage is histone H1, which is kind of surprising because it's a nuclear protein. It's supposed to not to be highly fucosylated. And on the other hand, the core histone H2, H2A, 2B, 3, and 4 is not fucosylated. And because H1, the major function of H1 is promote the chromatin packing, therefore we look at the chromatin structure and highly consistent to the mass spec data that in the M1 macrophage, the chromatin structure is kind of relaxed, it condenses, compared to M2, which is highly condensed. And the treatment with 2D gel can really change the chromatin structure from M1 line to a M2 line. So a hypothesis that in M1 inflammatory macrophages, there's upregulation of FUT expression and also a higher condensed chromatin structure, higher expression inflammatory cytokine, and lower expression of anti-inflammatory cytokine. And this condition is complete opposite in the M2 macrophage. We then look at the amino sequence H1 to figure out whether it can be fucosylated. And we did found a potential and glycosylation sites here in the global domain of H1. We then purified H1 from the M1 macrophage and cleaved the glycans and look at the glycan structure in by using melting top mass spec. And there are totally 23 different N glycans that can be detected from H1. This glycan also had core fucosylation or terminal fucosylation, fucosylation on this N glycans. So we're trying to figure out how H1 fucosylation regulates gene expression. The first thing we were trying to figure out is whether H1 fucosylation can regulate the enhancing activity in M1 macrophage. Enhancing usually can be defined by H3K27 acetylation and H3K4ME1. There are a couple of histone markers that have been identified in macrophage that play a very important role in the regulation of gene expression, which include a positive mark and negative mark. The most important positive mark is H3K27 acetylation or H3K4 methylation. So we then perform a TRIPS study to figure out whether fucosylation play an important role in the enhancer activity. As the TRIPS data here, at the M1 signature gene loci of macrophage, including TNFα, MHC class 2, IL-12, and IL-5. In the M1 macrophage, all these loci have a very high activity of enhancer, as shown here. However, with the 2D gel treatment, the enhancer activity is suppressed and looks like more like M2 activity here. So histone H1 is the key protein that's highly fucosylated in inflammatory macrophage. and different enzymes can be detected on H1, including core and terminal fucus. Fucosylation of H1 reduces comedones condensation. Fucosylation of H1 promotes the enhancer activity at the M1 signature gene loci and determine the M1 inflammatory cell identity. People that contributed to this study, including Dr. Zhongma, Huichen Xu, and also Dr. Zhao is in helping with the CHIC study. The clinical sample was provided by Dr. Bridge, Dr. Kimberly, and Dr. Spalding. And Jan Mobley and Presto and Mayumi was helping with the MESPEC study. And the funding was from Arthritis Foundation and NIH and VN. Thank you very much.
Thank you, Dr. Zhenli, for a very interesting presentation. Any questions, anyone?
Okay.
Thank you. Questions. Thank you very much, Zhenli.